Hi, I'm Dominic, and I don't recall exactly how I injured my elbow initially, but it wasn't too bad. It was just a little bit of pain, and didn't keep me from doing anything. I would go to work or to the gym, all that. And I was shoveling snow in January, and after that, I knew it was bad. I knew I messed it up bad. So, and I couldn't really do anything. Couldn't pick anything up. I couldn't turn doorknobs, shake hands, anything like that. So when I went to the doctor, he had an MRI, diagnosed me with severe tennis elbow and partial tear in the tendon. So he gave me a cortisone shot and suggested I do physical therapy. So I came here because the doctor's right next door. And Dr. Jacob explained to me what he was going to do, something called Mulligan technique, some joint mobilization, that kind of thing. So he did that, and with the gripper. So he would work where I would feel pain, and then he would manipulate the joint and move it around until I didn't feel any pain anymore, squeezing, and we would strengthen it that way. So and this is we've been doing that, other strengthening exercises, and today is my 8th visit, and my mobility is greatly increased. My strength is, it's not exactly 100%, but I think about 80% of the way. And pick things up, I could grab things, I could shake hands and turn doorknobs. So, now it's been pretty good experience here, and I have the utmost confidence in them.
Hi, so this is what I did for Dominic. Dominic came in with pain with gripping, lifting his wrist extension was painful. He also brought in an MRI which showed severe lateral epicondylitis with some partial tearing of the extensor mechanism. Although there was a partial tear, I tried the Mulligan tennis elbow just to rule out. See, Mulligan's techniques are a test and a treatment in itself. So I tried to distract or laterally glide the joint, and he was able to handshake, grip, extend the wrist in the absence of pain. So that was my treatment approach for him. I also included ultrasound, electrical stimulation, stretches, and different exercises. He's about 80% better now, and it's his 8th visit today. So this is what I did. This is how we perform the Mulligan tennis elbow, MWM. So it's on the elbow joint, slightly on the proximal elbow joint, distal to the humeral epicondyle. We are laterally gliding the elbow joint and having him squeeze. Go ahead and squeeze. Do you have any pain there?
Very slight.
Very slight. So we want to do it completely in the absence of pain. So what I'm going to do is I'm going to try to alter the distraction force, the angle of glide. Go ahead. Any pain there? Good. Good. There's no pain there with that gripping. Go ahead. Squeeze. 6 times. 6. Any pain there? No. Sometimes, actually, in some of the patients, we see that they also have pain when they release and go into a little bit of elbow flexion. Did you have pain while I bent your elbow? No. Okay, so squeeze now. Do you have any pain there? Good, there's no pain there.
No.
So let me increase the angle. Squeeze there. Pain there.
Nope.
All this was painful when he first came, and he had pain in 30 degree, 60 degree, and 90 degree. Squeeze.
Is a little bit.
A little bit of pain there. So I'm going to have you bend your knee. Go ahead, bend both knees and squeeze. Just shift a little bit to that side. Go ahead and squeeze now. Any pain there? 0 pain. Good. 2. No pain.
No pain.
Good. Relax. So let's retest at full extension. Go ahead and squeeze. Pain. I'm not gliding it. I'm not doing anything right now. So go ahead and squeeze. There's no pain there.
No pain.
Squeeze now. No pain there. Squeeze. No pain there. In his case, he also had pain with that range of elbow. I mean, and that we know because he has a small tear. So go ahead and squeeze. No pain there. Let's use this and squeeze now. No pain there. Are we here?
A little bit.
A little bit pain there. Mulligan also has spoken about working and mobilizing the olecranon. So I'm just using a little gliding force over here on the olecranon. I'm going to have him squeeze. Any pain there?
No.
0 pain there now.
Right.
So it actually becomes easier to understand Mulligan's approach. What I found out that I could actually alter the way the joint is and help him do movements in the absence of pain, right? So he had pain with different ranges of flexion of the elbow and pain with gripping. We could correct that with a lateral gliding of the elbow joint. One more time, let's go ahead and test. Squeeze. Pain there.
No.
Pain over here. No pain there. Pain here.
Nope.
Squeeze, pain there.
Tiny bit.
Slightly bit. Let's work on that range one more time. Now, if I want to, I could actually tape the joint and send him home with the tape. Any pain there?
No.
All right. 10. Good. Thank you for watching.